think just really appreciate how much physicians are needed in just every aspect of the healthcare system. Don't feel like the medical degree means you just have to practice clinical medicine. We are needed, our expertise, our wisdom, every aspect of it and every part of it is valuable.
Hi, Leigh Ann. How are you?
Hi, I'm doing good. How are you?
I'm good. Thank you. Thank you so much for your time on a Sunday.
Thank you. Thank you for having me.
Hi. So tell us a little bit about your journey from clinical medicine to utilization management.
Okay. So just briefly, I started my journey in clinical medicine. That was in 2012. Actually, it was when I got out of residency, of course, in 2010. So for a very brief time, I worked in a private practice just for about 6 months. And then I entered my career in the VA hospital system. So from 2011 until 2019, I spent the majority of that time outside of a year and a half basically doing direct patient care in a variety of roles in the VA hospital system. Around 2018 is when I actually started feeling like I want to make a change. Around that time, I had a medical situation where I had to have surgery and I was out for about 6 weeks. And that was really probably the first time I was really forced to kind of sit down and have to really kind of take, an assessment of just my life and my career and where I wanted to be. And around that time is when I thought I wanted to make a career transition. At that time, I was thinking public health. And that's when I started taking some courses at Georgia State to ultimately get a master's degree in public health. So that really is what started my thought process about making a transition. And again, at that time, I thought it would be public health. And that's when I actually left the VA hospital system again for about a year and a half and to go into academia, because at that time, I didn't know, maybe it was just the setting. So I
Mm-hmm.
thought, let me try a different setting. So I
Yeah.
left the VA system, went and worked in an academic setting for about a year and a half, and still felt that itch that it wasn't just this situation. Of course, around that time when I left the VA system, it was October of 2019. So, of course, what happened in that year and a half? COVID, right? So, who would have predicted that during that time when I was making this big transition that would have happened? So I actually left that position in academia for a telemedicine position back in the VA hospital system, primarily because we were having some pressure to go back in the office. And during
Mm-hmm.
COVID, I just wasn't comfortable, and this telemedicine opportunity presented itself. That was also really great to do that transition, because I think if anything, it really cemented that I did not want to do clinical medicine. So I changed my setting doing clinical medicine, and then I
Mm-hmm.
actually changed like the way I was giving it by telemedicine. And then
Mm-hmm.
that also totally cemented it. I was like, I still don't want to be in this kind of the direct patient care. And
Yeah.
so that's when I started doing research into just the different avenues and the different options. I joined Facebook groups. I started listening to podcasts. I started, just looking on like LinkedIn, started updating that
Mm-hmm.
profile,
Mm-hmm.
started rewriting my resume, um, and just started, more so exploring my options about what my transition would look like. So that's kind of the short story of how I started my transition to UM.
Yeah. How long did it take from starting the preparation, making your mind that this is it, and getting the job? Like, how long did it take you
I want to
at
say
that
from
time?
the time I started like really seriously interviewing to actually get in the position I have now, it was honestly 18 months. I will say though, within the 18 months, I had taken FMLA.
Mm-hmm.
I had adopted my daughter during that time period. So I had taken FMLA, and in our system, when you do that for a parental leave, we had a program. If you do 12 weeks, you have to come back for 12 weeks. So in that
Uh-huh.
18 months, it was like basically 6 months that it was part of parental leave. So I guess I
Yeah.
was outside of that about a year.
Okay. Awesome. How do you like your new job?
I
Is it
really
new?
like
How long have you been doing it?
I really like it. So it's August of 2023, of course, while we're recording this, and I started in April of 2023. So it's
Mm-hmm.
been a pretty early transition.
Mm-hmm.
And my role in utilization management is primarily doing UM. That's the bulk of my role. I have a small amount of quality review that has like just recently been introduced. So in my company, they really have spent the majority of this kind of, I guess, new onboarding process getting used to UM. I didn't have any UM experience before I started this role, so it was a pretty significant learning curve. My team is also a brand new team. So the company that I'm with previously had outsourced all of their utilization management. So it's been a big transition for the company as well. So it's been a lot of change, of course, for me personally, but also for the company. And we're still going through a lot of change. So it is sometimes month to month, different changes as we figure things out. Different processes are changing pretty rapidly. So I think that's something to keep in mind too, as people transition. You might transition into a company where it's well established. In my case, I transitioned where it literally is a brand new team. There was my team is 4 doctors, and only one was there established before. So me and the other 2 are totally new as well.
Yeah, and that I think in the last few years has been happening across the board. All of the companies that I knew, for example, Epicor, Magellan, AIM Specialty Health, they were all eventually something else, right? So they have a new name, they're rebranding, they've been acquired, or they're making changes to improve stuff. So yeah, that's always a possibility that when
Big
you
change.
consider, yeah, a big change. What is your specialty? Yeah,
My specialty is psychiatry.
psychiatry. So, how difficult is it for psychiatrists to transition out of clinical medicine?
I think that is a really good question. I think particularly in the UM space, because typically psychiatrists are just reviewing behavioral health cases. So I feel like the opportunities are smaller. I do find that when people get their utilization management jobs, they keep them. There's not a lot of the openings don't come open very often. And as you know, in this space, like sometimes like your licensure really depends. So it may just be if you have a California license or Illinois or whatever. And because they are so scarce, it can be a challenge. And I think like with my case, that was, I think, part of what took so long in the transition is finding the opening where your license fits. And then, and that they want a person or are open to a person that doesn't have like experience. So I know one of the interview processes that I went through where I was one of the final candidates, in the feedback I got, which also, and we may talk about this at the end about interview process, I was lucky enough to get feedback, and it was really good feedback. But that was the feedback they gave me. They said, look, it came down between you and another person, and we chose that other person because they did have experience. And so I think finding the roles with your license and all this stuff, and that your experience, that they will be open to you. So for me, I think especially for UM specifically, that might be the challenge, that I think the jobs sometimes can be few and far between. And that particularly if you're trying, I guess I'll say if you're trying to go with an established company, there are some independent review companies that were, if you're doing part-time or kind of as a side gig, it might be easier. But if you are trying to get with one of the larger, Magellan, Elevate, Cigna, Humana, or something like that, those openings do not come open very often. So you have to almost be kind of in the right place at the right time.
Yeah, and I would say to those people who have more than one licenses and are thinking of getting rid of a license or two and are considering a transition, I would say that's an asset to have more than one licenses and keep them until you have successfully, made your transition, because you may be looked at more favorably for having more than one licenses.
For sure. Definitely for UM. Like since I've been here, I'm actually in the process of applying for like another license, like just since I started from April. So definitely in the UM space, having more can be seen as an asset.
Yeah. So let's talk about the interview process then. What does it look like to interview for a UM job?
Yeah, so definitely what my process, and I interviewed, I had, I guess it's okay at this point. I'll just name the names who I interviewed with. I think that's fine. So I interviewed before I got my current position with Elevance. It was Cigna. I made through those process. So with Cigna, I just had like screening interview.
Mm-hmm.
And I think in that process, it was very, I guess I had also a screening interview with Aetna's CVS. I think they're together. So those processes, and I guess I feel like in the clinical world, a screening interview is more casual. And I would just say in this world, take the screening interview very seriously. Because I think
Seriously.
particularly the screening interview I had with like Cigna and the NCBS, those were like the two I did at first. And I would say I was not ready. I don't think I was ready on the level that I
Uh-huh.
needed to be at all. And then when I got to Elevance, and those are the two interviews I had where I actually went through the whole process, I was ready.
Yeah.
Ready. So take your screening interviews very seriously. Don't, again, I think in the clinical world, maybe they're a little more casual.
Mm-hmm.
Um, and so what it looked like for me was talking to a screener. I almost had like an elevator pitch ready for those. I mean, to me, that's how serious they were. They, would talk to me about, even in those ones, I had like some basic information about salary, asking me some basic questions about that. So definitely have a little bit of prep for a screening interview. Maybe they'll be casual. Mine weren't. They were, I feel like, asking me some kind of really basic kind of interview questions, some of those. And then when I went advanced to the next process, it was very structured. They started out with the hiring manager for those two interviews. And then once I got through the hiring manager, it was a lot of interviews. And I think that's the one thing compared to like the clinical realm that I honestly, I don't think I was as prepared for, because I was still I was still doing my clinical job, and I had
If
to.
I remember, yeah, if I remember it correctly, so, the clinical interviews are pretty straightforward, right?
Mhm. And I don't think it was that many of them. I mean, and I don't know if
Yeah.
it's just the nature of doing it online as opposed to if you could go in person and like have an interview panel. But I had like multiple, individual interviews, and it was actually a challenge for me to try to schedule around all of the interviews. I would say on average, I had interview individually with like 5 different people.
Yeah. Yeah.
And again, when you have a full day clinic, trying to schedule like over lunch or at the end of the day. And again, in you have a much more flexible schedule. Like today, it would be easy for me to take a meeting. So their schedule is much more flexible than how mine was. So trying to accommodate for that, it was a real challenge. And then with my current, so those were the two interview processes I went through. Of course, I did not get those roles. And then with my current company, the job I work now, very similar. Unfortunately, I didn't get to meet with the hiring manager first. There was some like logistical issues. So I had a whole prep that I usually would do all my questions with the hiring manager. And I didn't know the last minute that I wasn't meeting with him. So then I was just meeting with some who are now my coworkers. So it was a little bit awkward. The prep didn't go as well.
Mhm.
And they didn't know that I didn't know what the role was. Because typically the hiring manager kind of does all that. So
Yeah.
I didn't know this was a new team. And so, like, for example, I was prepped to ask the questions of an established role. And so, like, I'm
Yeah.
asking these questions. They didn't know because the role didn't exist yet. So I would say, like, how many typical cases do you do during a day? We don't know because we've never done this role before. It was a very awkward interview. And honestly, I didn't know how I did because they didn't have an answer to a lot of the questions I was asking. And it just didn't flow very well. But and I
That's
too is okay, but
that's also across the board. I think in clinical medicine, when you go for an interview, you are pretty clear what you're getting into. And as far as non-clinical jobs are concerned, in utilization management, I think that somehow they expect you to know everything and aren't prepared to give you answers about much, right? So you go in thinking that they are going to tell you about the job, and they are already thinking that you probably already know, that's why you're here. That's what my understanding is, because a lot of interviewees will come back and say, my questions were not answered.
yeah, and I feel like I got the most from the hiring manager when I would talk to people who would like be your colleagues or other people in like within the business. They know their business, they may not know your role. So I
Yeah.
would say that's one tip I would say. look up your interviewees if the people who are going to interview you, if you can. That's what I did. So, and just understand and then ask them. That's what I would do. I would ask them, like, okay, if I was to get this role, how would I interface with you? And then try to tailor your questions to that, because that's what they're going to know the most. And then like the hiring manager or someone, if it exists, your role, ask them how your typical day would be and all that. I definitely got behavioral interview questions. And so I was already prepped for those. At the VA hospital system, we have that. So I was very familiar with that process. So how I prepped for that is I had about 4 or 5 scenarios memorized. I had them written down too, but I had them memorized. And they were the kind of scenarios that you could answer for a lot of different questions. So, like, tell me about a conflict. So I had a couple of different scenarios I could answer with that, like memorized. Tell me about a time, that you overcame some type of difficulty. I had a couple memorized that I could use that, because that question could be asked different ways. So I feel like I tend to do pretty well on those because I prep those ahead of time, that I can kind of finagle to answer different behavioral interview questions. I got those on every interview I went on. So again, I don't know if that's been your experience, but I got behavioral interview questions on all of the interviews I went on.
I think fewer for me. I'm family medicine. Maybe that's why.
Oh, okay, maybe because psychiatry. Good
Yeah.
point. That could be.
Um,
Maybe it's a psychiatry thing. I got them on everyone that maybe not every interviewer, but someone along the way asked me a behavioral interview question. I didn't even think about that, but that's probably true because it's psychiatry.
I think that you gave a really good advice there, as far as the interview expectations and understanding of the process. And I would also say that make sure you have networked before you go for the interview, because that way you are able to speak to somebody who has already gone through the process, and you can pick up some really helpful tips there, in order to be better prepared for your interview.
Yes, and then after that, again, the interview process I went through were very structured. So, fortunately for me, they basically said afterwards, the time frame in which they would contact me and let me know, and they pretty much did that exact time frame. I know some people have said that they haven't heard after their interview process and they've had trouble getting feedback. Not in my case. For the position I have now, literally, but they were very open. They were like, we're trying to get this team started, you will hear within a week, and I did with my offer. Even for the 2 positions that I went through the other whole process and I didn't get, I heard back very quickly. I think it was probably within a few days actually. And this is a good thing. The person who gave me the feedback, who was the hiring manager for those 2 positions, he called me personally, he gave me the feedback. And I felt like I had such a good rapport with him that actually we are connected on LinkedIn. He gave me his personal number and he offered to be like a mentor with me after I told him I got this position I have now, just like in the industry, because he's been in utilization management. So I also want to make the point that even if you don't get a position, use your interview process as a time to network, because even though it just so happened that the second position I didn't get was one where they preferred to have a child psychiatrist. And after he called me for that one, he said, listen, we rarely get child psychiatrists. He's like, it's so unusual. He said, this time we got 2 people in the interview process. So they interviewed me. I'm not a child psychiatrist, but they got 2 other people who were. And because in that business, they deal a lot with autism and ABA and things of this nature, they wanted someone who was more familiar with that. And, but I appreciated it because, when you don't get a position, you always wonder why. And
Yeah.
I appreciate the fact that he called and told me, but that he also offered to be like a mentor for me in this business because he just appreciated like my work and how I interview. So even if you don't get it, please know you can also use your interview process to network. And he has become a contact for me, even though I don't work for that company, which I'm like, so I feel so privileged that he offered that. So, and it was good feedback because he gave me some other feedback from my first interview process, the way I answered the question. I'm going to tell you what the question was. I got asked, do you have any experience? And I said, no. And after that interview, he said, don't answer that
You
way.
do have no, you do have yes.
Exactly. And you're a coach, so you would have told me that too. See, that's why I'm saying when you don't,
Yeah.
you're new to this and you don't know,
Yeah.
he said, when you get asked that, you tell me all the transferable skills that you have for this role. So you're shaking your head. That's what you do. And so that's the valuable feedback that you can get along. And when people appreciate how you show up, you'll get
Yes.
that. Even if you're lucky enough, if I probably needed to I made so many mistakes, but it ended up working out. But yeah, if you get asked that question, the answer is not no. You answer with your transferable skills.
Right. And with physicians, and I'm sure with other healthcare workers as well, it's a challenge because we have this one track mind when we're in clinical medicine. And our self concept is all built around that one track mind that we are physicians and this is what we can do. So it takes them a while. Some people, it takes them a while to really embrace that I do have these transferable skills, that I do have UM experience and really communicate it. And I think that makes a difference during the interview.
Yep. But yeah,
Yeah.
it was a very long process. And I think just don't be discouraged. And I think, again, as physicians, especially in psychiatry, it's so underserved that it's so easy to get a clinical job that I think when I was interviewing and it wasn't happening, it was easy to get discouraged. So I think just know that you have to expect no's and rejections during the process. And again, you'll find your spot. And people were telling me that during the process, and it was hard to hear. But I think you just have to expect that you might hear no's and that it might take longer than you expect. And, that could just be part of the process.
Are you able to share a range of salary? You don't have to give exact numbers.
Sure. And I do think I want to kind of preface this because I've heard like some other UM salaries. So I figure that maybe behavioral health is on the higher end UM for salaries. So when I was interviewing, and this is true of the salary I have now, I would say the lower end for psychiatry was 250. And I would say the upper end and from starting, like for without experience, is going to be about 285. And that's kind of where my salary falls in as well.
Okay, great. Thank you so much for sharing that. Um, what advice would you give somebody considering a transition out of clinical medicine?
What I would say is to start is really go internally and really think about why you want to make the change. And like I said initially, when I started thinking about a transition, I really did think like maybe it's the location because like at that point I had been in the VA about 8 or 9 years. So I thought, let me try a different site, let me try a different modality. So I'm doing telemedicine. So really think about why you want to change. And I know this sounds like such a cliche because I do hear this all the time, but you don't want to necessarily be running from something. You want to be like moving towards something. And I'm glad that I spent that like couple of years there really trying to figure it out because I don't feel like I escaped clinical
Mhm.
medicine like I do. Because I see a lot of people making the transition and they sound so desperate. And I'm glad that I did not make the change in like desperation because I think if I would have done that going into this role, it may have not been as like a smooth, like as pleasant transition because there was like some of the things that I did need to kind of work on about why I was so unhappy. Because it turns out for me, it really wasn't the patients. I actually love working with veterans and I miss that part of clinical medicine. It was things about the system and believe it or not, those things about the system still exist because I still work in a bureaucracy.
Yeah.
So I had to learn how I was going to navigate some of those. Now, I don't have all of those things. I have a lot more freedom and flexibility, So I don't have all of those things, but there are some of the things it was about working in a bureaucracy. That was a federal government bureaucracy, but I still have those. And so I had to learn how I was going to navigate those in a workplace. And so if I hadn't done that, I would still potentially be unhappy. So I guess that's like one of the biggest pieces of advice I would say. If you're feeling desperate, if you're feeling overwhelmed, if you feel like you're running from, if you can, take a little time to really try to figure out why you want to change, and not just feel like you need to escape. Because I think if you do that, you might run into another position and still find yourself like really unhappy.
That is such a great advice. That is, I think 9 out of 10 people who I meet are running away from clinical medicine and they have this urgency. Um, and, there is an expectation that I am a doctor, I'm trained, I should be able to find a job right away. But then there is, in the non-clinical world, there's a job market that is quite saturated now. There's so many physicians who want out of clinical medicine, that the transition itself is challenging. It's not very straightforward. So I agree with that. Thank you so much for sharing that advice. I think everyone should do inner work before considering a transition out of their current job, if they want lasting results. In the end, if is there something that I forgot to ask that you would like to mention?
I just think that, I think if I could go back, and tell myself, because, I really do, enjoy the job that I have now. It's not perfect. I feel like I have a paperwork job. I spend my day looking at charts. I talk to doctors. I mainly work with Medicare. So, again, it's been a learning curve because being in the VA hospital system, we don't really deal with insurance. So I've seen, I guess, just like another side of medicine that I, in a lot of ways, wasn't exposed to. And it's a little ugly over here. In a way that, I was kind of shielded from. But it's opened my eyes to just a lot of different things about, not that I was totally didn't know about it, but, I understand it in a different way. And then to be from the business side of it, the business side of medicine. But I think if I could just go back to myself before I made my transition, I think I would just encourage myself really to just explore all parts of medicine. And I think just really appreciate how much physicians are needed in just every aspect of the healthcare system, because I feel like there was just always a little bit of shame about the transition. And maybe that's just part of UM too, because UM in some ways has kind of a bad reputation.
Right.
But we're still needed in UM. Like there's some regulations where physicians have to be involved in the decisions that are involved in utilization management by law. So we're going to have to be there. And I feel like if I have to be there, I know how I interpret the regulations. And I feel like I do it in an ethical, the caring way, in a way that supports the patients or members, as we call it from this side. So I think if someone has to do it, then I'm a good person to do it. But whether it's pharma or medical, right, like we need to be involved in every aspect of
Yes.
it. So I think I wish earlier in my career I could appreciate that more. That's all I would say. Don't feel like the medical degree means you just have to practice clinical medicine. We are needed, our expertise, our wisdom, every aspect of it, and every part of it is valuable. So that's all I would add.
Absolutely. Thank you so much. I think this will be helping so many physicians considering a transition into utilization management. I appreciate your time, Leigh Ann.
Thank you.
Let's get together some other time.
I will. Thank you.